There are over 7,000 people living with dementia in Warwickshire, and this is expected to rise to over 9,000 in the next 10 years.
Can you remember our first house when we got married?
In Hornbeam Grove?
Yeah.
Yes, I can remember that. But that's not so long ago.
No.
I'm thinking of...
It is a long time ago. It's 44 years
44,
ago.
Yes, I can remember that.
What do you have difficulty remembering?
Well, even my own daughters, I've said to you at times, sat there and I can't remember what her name is. There have been times that I've talked to people and I couldn't remember your name. I've lost an awful lot of things, so it's difficult for me to tell you what.
You can't remember?
I can't remember, because if I could remember what I've forgotten, I'd remember something about it.
It's important that people who have dementia feel reassured and supported when they're out and about. That's why Warwickshire County Council are committed to working towards becoming a dementia-friendly community. Being dementia-friendly is about understanding the impact the condition has on a person and their life. It's about organisations and individuals helping people with dementia to feel supported, welcomed and encouraged to access their community. Some organisations in Warwickshire are already working towards becoming dementia-friendly.
We really want to make the Spa Centre accessible to everybody. There are a lot of people in our community who live with dementia, and they want to access the theatre as much as anybody else. And if we can go a little way to helping them and making it a really good experience, from helping them get their tickets at the box office to helping them be seated, then that's a job well done, I think. We've made all the signage as readable as possible. It's clutter-free, and most importantly, all the staff have been trained about dementia awareness, and they go that extra mile when somebody comes to give them an enjoyable experience at the theatre.
Early in 2013, our prevention department undertook the challenge of becoming dementia aware across the service. A lot of our training is done through a computer-based training system, and now all firefighters will log on. They will go through the dementia programme, which gives them awareness, it gives them pictures, it gives them signs, symptoms, and then at the end of it, it will question them about their knowledge of dementia. Warwickshire Fire and Rescue Service are dedicated to ensuring that all our staff become dementia aware so that the community of Warwickshire is safe moving forward.
Pharmacy is an area where we can do lots of things to prevent dementia and support patients with dementia. So we can look at both aspects, raising awareness about healthy lifestyle, taking regular exercise, eating your 5 a day, reducing blood pressure, reducing your cholesterol. These all reduce your risk of dementia. It's mostly about awareness, making sure that they're aware of some of the needs of patients with dementia, so bigger print labels, monitored dosages or blister packs if necessary. And being patient, I think that's the most important thing. It's about making sure we provide a wide range of services to cater for everybody.
Alzheimer's is the most common cause of dementia.
People think of memory loss or Alzheimer's and they just get a stereotypical picture of somebody sitting in a chair, unable to speak, unable to do anything. But what we don't realise, it's like with any illness, you start at one end of the scale.
Yes.
And that is the end stage.
If I'd limped, would that help? Or perhaps if I jutted my shoulder or wobbled my head around all the time, things like that, would that, if you saw me doing that, would you say, oh, he's obviously got Alzheimer's? That is not the symptoms of Alzheimer's. Alzheimer's is something internal, and it's the brain.
Every person is an individual and will experience dementia differently. It's common for people living with dementia to have problems with thinking and reasoning, forgetfulness and memory loss, confusion and disorientation, feeling fearful and suspicious, and mood swings during times of anxiety and stress.
But when somebody asks you something and you've got to give a specific answer, that's when you get very confused, because everything goes blank.
I don't think I'm talking confused. I think I'm talking sensible, and folk get irritated because you're obviously being stupid. I don't realise that I am confused.
But again, I think this is why the dementia-friendly communities is going to really help. Because if you've got the major stores and shops, and you know that they've perhaps done that basic training now, because we can't expect people to understand what it's like for somebody with Alzheimer's if they've had no knowledge of it. But if they've had some basic training, and then they come across somebody who's confused or not quite sure of what they're doing, and they can just get alongside and help so that it reduces your panic, then things become a lot easier for you. And they become then a lot easier for me because I don't have to worry so much.
Yes. So Alzheimer's is difficult for not just the person who has it, but the person who doesn't have it. We just have to take each day as it comes.
Do you run a business or organisation in Warwickshire that is regularly visited by members of the public? Would you be interested in becoming dementia friendly? For more information, please contact the Living Well with Dementia Partnership on 01926 742 214 or visit www.livingwellwithdementia.org or email dementiapartnership@warwickshire.gov.uk.